Think about this for a second. You can spot a mouth breather from across the room, but what if that small habit is reshaping a child's face, disrupting their sleep, and potentially setting them up for autoimmune diseases later in life? My guest today is Dr. Toni Ingram, a biological dentist and the founder of Flourish Dental Boutique in Dallas. She's at the forefront of connecting oral health with systemic health, from the way mouth breathing can shape a child's development to how your oral microbiome can influence autoimmunity, heart health, and even stroke risk. Today, we're going to go into topics like nitric oxide, the oral microbiome's role in inflammation and disease. She shows us that the mouth isn't just about cavities and cleanings, it's actually a gateway to the whole system. We're going to speak about that this might be the missing link in chronic illness and how simple daily practices can change everything from your breath to your brain health. At the end of this episode, please listen closely to a contest and giveaway related to your own dental hygiene, where we'll be giving away a microbiome testing kit for your oral DNA. So please listen for the end of the episode so that you can participate in this contest. So without further ado, I welcome you to this week's episode with Dr. Toni. I know you'll enjoy it as much as I did. Please share it widely with your friends, family, and loved ones, and anybody you think might be interested in it. Thanks again, and welcome to this week's episode of the One Thing Podcast. Dr. Toni, welcome to the One Thing Podcast. I'm so delighted to be here with you today.
Thank you so much for having me, Dr. Adam. I'm glad to be here.
You're welcome. Yeah. It was great getting to know you a little bit offline here. And there's, as we were mentioning, this topic that we're going to get into is often overlooked a lot by clinicians, and patients don't know how to connect some of these dots or connect some of these concepts with their provider. So I'm really looking forward to hearing and learning from you. I think some of the fascinating things I've researched or heard from your work is how you look at all aspects of the mouth, from breathing to the microbiome, and looking at also just the environmental impacts and the impact of oral health on autoimmunity. So I'd like to get started really with a concept that is fascinating from a dentistry standpoint, and that's the impact of breathing. So can you share why the way we breathe is so important for oral health?
Man, and it once you think about it, it just makes sense, right? That how we breathe through our nose and our mouth, that of course it's going to affect the health of our mouth too. So what's interesting is that we're designed to primarily breathe through our nose. That's how the system was set up. Now, I think it was brilliant that we have a backup system so that if we get sick and we can't breathe through our nose, or if we need a lot of oxygen really fast because we're running from a tiger or a bear, then thank goodness we have our mouth as a backup system to breathe. But it's just meant to be a backup. So when we breathe through our nose, we have the benefit of filtering the air, and there are cells in our nose that will actually produce nitric oxide as we breathe that helps protect our heart. So if we're breathing through our mouth more often than we should be, then we don't have those things. We're breathing in unfiltered air, so we're exposed to more junk in our environment, which is, more and more prevalent, and we're not getting that heart protective nitric oxide that we really need either. And not only that, if we're breathing through our mouth more often, then it's naturally going to dry out our saliva. And when you dry out the saliva, that causes a whole host of negative effects on the health of our mouth. It shifts the bacteria in our mouth in the wrong direction. We no longer have the saliva to wash away some of the plaque from from the night or even the day, depending on when we're breathing through our mouth. So we'll get more plaque buildup. It makes us more prone to tooth decay, more prone to gum inflammation. So, sets us up for gum disease. It really just can wreak havoc. But then, and that's primarily adults. When we talk about kids, it's all of those things plus a ton of growth and development effects.
Hmm.
So we can get all into the nitty-gritty of that if you want, but essentially if your child is breathing through their mouth during those crucial years when their mouth and their jaw and their airway is growing, then it will have a huge impact on how those things grow. And so I've even trained my own kids that we can see a child who has trouble breathing, we can spot it from a mile away because you start to see these dark circles under the eyes, what we call venous pooling. You see a longer, lower face. They start to get everything just kind of grows down. You'll get this recessive chin, so more overbites. And typically when we have mouths that grow the way that they're supposed to, part of that is because their tongue is resting naturally along the roof of the mouth. Lips closed, tongue to the roof of the mouth. That helps guide this wide growth of the palate. So if the mouth is open and that's not happening, if the tongue is kind of falling to the floor of the mouth, then the tongue is no longer the strongest muscle
Mm.
in that area. Then the cheeks become the strongest muscle. And the direction of the growth and development goes from wide, beautiful smiles to narrow, restricted smiles where there's not enough room for the teeth.
Mm.
Part of the reason we're all having to get wisdom teeth removed so frequently, there's just not enough room in there and things aren't growing in the right directions. Um, but most importantly, if that's happening, then their airway is actually growing smaller too. It's not just their jaw,
Hmm.
it's their airway. And so we'll see extended bedwetting, symptoms of ADHD, this tonsillar hypertrophy, these kissing tonsils that are just always constantly inflamed in the back of the throat. And it really just sets our kids up for this nightmare of health effects that take me and the pediatrician, usually a functional medicine nutrition pediatrician or a naturopathic pediatrician, to kind of unwind these things and get them set up for success and growth and development again.
Hmm. So I think a lot of people, when they're seeing mouth breathing, they go right to the nose as being like the problem. And you mentioned, that you're seeing all these developmental changes, especially in kids, bone structure changes and face changes. Why isn't it not the nose that's the issue, or is it also a contributor?
Well, it can be. It can be partly the nose. If you've got a deviated septum or you've got some inflammation in the soft tissue in the nose, then absolutely that can play a role too. But then it becomes like this chicken or egg discussion.
Hmm.
Like, was it the anatomical features of the nose or the back of the throat? Is that what caused some of the congestion that forced that person to need to breathe through their mouth
Hmm.
more often? Or was it other things? Was it maybe a tongue tie that caused them to breathe through their mouth
Hmm.
and then they developed that habit, and breathing all of that unfiltered air caused the inflammation in the tonsils,
Mm.
the inflammation in the sinuses.
Mm. Okay.
So it becomes this really interesting case of what was the root cause of the root cause,
Sure.
um, and how do we get the most bang for our buck? How do we fix it the fastest
Yeah.
to get things to unwind?
I love that. What is the root cause of the root cause? That's such a great way of saying how these puzzles are, the cause and effect are not always so straightforward.
Yeah.
So going back to some of the things you just said, the filtration through the nose and using nitric oxide. What is nitric oxide and what is it actually doing for for the particles or the pollutants or the pH of the air as it enters the nasal passage?
Yeah, so nitric oxide is the way that we get all of this oxygen and anti-inflammatory cells into the tissues of the heart, into our circulatory system. If anybody in your audience has a chance, I highly recommend you look up a scientist by the name of Nathan Bryan. He's
Mm,
like the world renowned expert on nitric oxide.
yeah.
I've heard him lecture in person a few times. He's such a huge
Mm,
proponent of biological dentistry, so he's on my good side, obviously.
yeah.
But man, just a wealth of knowledge. And so he talks all about the nitty gritty of nitric oxide and how it works and how we can increase it and improve it. It's funny, not only it's primarily we get it when we breathe in through our nose the way that we're supposed to, but what's interesting is that there are also strains of bacteria in our mouth that also help reduce nitrates to nitric oxide, and help us produce more nitric oxide in the mouth
Mhm.
also. And so we can check for that when we're doing saliva testing and see if you've got those nitrate reducing species that can actually help you along the way, help
Mhm.
increase your nitric oxide levels.
Mm. Yeah, so it's interesting because it connects so much with cardiology as well, and we think about nitric oxide from a standpoint of vascular health throughout the body, brain, heart,
Yeah.
um, any really peripheral tissue as well. So, and such a vital part of if bypassing it through being a mouth breather. Um, what's the ultimate cost in your mind of that? Like when you with not accessing so much nitric oxide or the proper amounts, what what microbes tend to expand, or what's the microbiome generally look like in the mouth when that takes place?
When there's not enough of
Yeah.
it, well, anytime there's not enough balance in those in the healthy cells that we need or in the healthy bacteria that we need,
Mhm.
then it sets us up to create imbalance. It makes a way for those pathogens to really take hold.
Mhm.
And so we do see as part of this inflammatory process, we will see more of those pathogens like Porphyromonas gingivalis, Fusobacteria nucleatum, Treponema denticula, these pathogens that are some of the scary bugs that are associated with other negative health outcomes.
Mhm.
We can see those take hold a lot easier.
I gotcha. Okay. So for the saliva, so many conditions, and especially like autoimmune conditions, can set up where there's low saliva production. Um, how long, when there's saliva issues, do you start to see problems with cavities and other oral dental health issues? Like, is it a slow process, or can it happen pretty abruptly?
I mean, I've seen it. I've seen it both ways. Especially when we're looking at kids' microbiomes, it's really transient. It tends to shift really quickly,
Hmm.
and so it doesn't take very long of a disturbance for there to be some clinical symptoms, like some cavities will start popping up.
Hmm.
Um, and unfortunately, a lot of times we're seeing the cavities first, and that's what gives us the trigger to say, okay, we need to test the saliva and actually see what's there. Um, in adults, it again, a lot of times patients aren't coming to me until there's a problem. And then we're testing the saliva to see what's going on and how specifically we need to tweak things.
Hmm.
But that can take longer. Sometimes we'll see the imbalance in the microbiome first. And if we catch it and we make those shifts in time, then we can restore things back to some balance before there's anything that's clinically apparent.
Hmm. So you mentioned some obvious flags or features in children that they're mouth breathers. Is that similar in adults? Is it, or does it present differently? Is it not as obvious?
It kind of depends on what's going on in the middle of the night. So if they are mouth breathing and that's really all that's going on, but they're still able, like there's no apnea, there's no sleep disordered breathing, it's just that they breathe through their mouth, then we'll see the oral effects of that because it's still going to dry out the mouth. So you're at higher risk for gum disease because there's an inflammatory process, and you're at a higher risk for tooth decay. So we'll definitely see those oral health effects. But if they're mouth breathing because there's a deeper problem and there really is some sleep apnea or hypopnea or respiratory distress of any kind during the night, then yes, then we see other things that go along with that. And there are usually clues that present, we're always screening patients in the office when they come in.
Hmm.
Um, but I see signs also. Like we'll see what's called scalloped borders of the tongue. The
Yep.
sides of the tongue start to look like a really pretty pie crust
Yeah.
that your grandmother would make.
Yeah.
That's not normal.
Yeah.
A tongue that doesn't look like it fits within the teeth. We'll see flattened off edges of the teeth because if you can't breathe at night, then your mouth is going to instinctively kind of move around, shift to try to open up the airway. And sometimes there's more acid wear on the teeth, and so we can see that too. There a lot of times will be some silent reflux that comes with some of these sleep disorders.
Hmm.
So the other more serious sleep issues will absolutely have signs that we can pick up on.
That's really great. Good information, and I think those are clues that people, can see in themselves, or and obviously, if they're concerned that they're having an issue with their airway or breathing, they can, bring that up to their practitioner. And obviously, like, you know, we all see people sleeping with their mouth open on the airplane, but I don't know if
Yeah.
that's just an airplane thing, or or it is an actual mouth breathing sign.
Right.
But a partner is always a great person to point out whether you're a mouth breather. I know as
Mhm.
a clinician, is if I ask someone they're a mouth breather, I think there's some pride. It's like, oh no, I'm not. Just kind of like, do we have
Right.
bad posture? We sit up
Yeah.
all of a sudden, but other people can call it out better than ourselves sometimes. So if someone is listening to this and say they're just curious and they think they might be a mouth breather, what's one simple step they can try to encourage nasal breathing? Is there any just basic
Mhm. Yeah.
steps or
There
techniques?
There are actually. So I would say one that can be really helpful is mouth taping. But I want you to test it out first. Like, just don't go willy nilly and taping your kid's mouth shut,
Yeah.
or your spouse's mouth shut, even if they're too chatty. Um, what you want to do is you want to test it during the daytime first. Like try and you can do, they make mouth tape that you can get on Amazon, or you can just do medical tape. Like it doesn't have to be fancy, but put a little bit, right in the middle of your mouth, just one tiny little strip, and make sure you can keep it on for 5 or 10 minutes without feeling panicky, like you can't breathe.
Mhm.
Um, and then test it. If you feel comfortable that you can do it during the daytime, then try it at night. See if you can keep it on for an hour, and then kind of work your way up. Because anytime there's something new on your face or around your mouth or anything like that, then sometimes it just doesn't stay on for the whole night in the beginning. You kind of got to work yourself up to it. So don't feel like you failed if the tape comes off in the middle of the night the first time you try it. Um, so that's how I would recommend doing mouth tape. And that's super, super easy, simple to do. The other thing that has no restrictions really at all is some xylitol and saline nasal spray.
Mhm.
That can be so, so helpful and so easy. Like I can't think of a single person who can't do it. There's the rare person who might have a xylitol allergy. But even if your digestive system is really, really sensitive, you can usually still do the nasal spray.
Mhm.
So the xylitol and the saline, not only will that help just kind of clean out and thin out the mucus over time, but the xylitol will shift the bacteria in your sinuses over time as well. And so you'll have less of that sinusy drainage over time, less of the inflammation. And so I would say, especially if you are prone to seasonal allergies, if you start doing the nasal spray, a few weeks before your allergy season normally starts, then you can head that off by quite a bit. Um, and so I think those are my two favorite tools just to kind of give yourself a jump start for breathing better at night.
That's great to hear. And I really like how you uh, describe expectations, because I think it is so normal that the tape ends up on the floor or somewhere in the bed at some
Stuck
point.
to your hair.
Yeah,
Yeah.
it's stuck to your hair. And yeah, it's good to hear from a dentist to know that this is sort of a gradual process, and you can build up, and not everybody sleeps through the night with the tape on.
Right.
So, and it's really interesting. It's like 1 extra hour of good nitric oxide flow. You know, you
Seriously.
can build on that. Um, as you
Absolutely.
were talking, I couldn't help but think about the tongue positioning while having the tape on, and if people are used to being a mouth breather, where they might feel sort of awkward about where they would place their tongue. Like usually it's
Mhm.
probably just hanging out wherever it falls, but there's something to that too, isn't there?
There really is. And there's a new field. I mean, it's not that new, but it's really new in its popularity. And I'm so excited about it, called oral myofunctional therapy,
Mm,
or OMT. And we love our OMT specialists. A lot of them are also trained as speech and language pathologists. A lot of them are trained as dental hygienists, and that's how they get started into OMT. But what they teach is that the tongue should, for proper breathing and proper development, for completely proper function, that the tip of your tongue should rest on the top of your mouth, on the roof of your mouth, just behind your top front
mm,
teeth. That's where it should be resting all of the time.
mm,
And if it's resting there, then you're required to breathe through your nose.
mm.
Like just
Yeah,
try to breathe through your mouth with your tongue in the right place. You
right,
can't do it.
right.
Um, so it forces that. And that's what those are some of the exercises that they'll do with our kids is they'll have every exercise, they'll remind the kiddo, okay, put your tongue on the spot. And that means right behind those upper front teeth. And so that's where we want it to rest. And that's why it's so important for parents of littles to have their kiddo evaluated for a tongue tie if they think that there are any kind of airway
Hmm.
issues going on, because sometimes the tongue tie can be the root cause of the
Hmm.
mouth breathing. If their tongue, and when I say a tongue tie, I mean the frenulum, the little string of tissue that connects the tongue to the floor of the mouth, if it's too tight, then you can't properly lift your tongue all the way up. And sometimes it's even, you can't lift the back of the tongue all the way up the way that it should. And it not only does it prevent you from breathing appropriately, sometimes it also prevents proper swallowing, can inhibit proper nursing when you're
Mm,
breastfeeding infants. And so that's important to look at because you want to remove any kind of inhibitor to breathing properly.
mm. Such a good point. And again, one of those things that I think people just overlook. Seeming like the tongue is not something to consider in the mix, but
Right.
since you're describing it under the terms of myofascial therapist, or um, people who work on the myofascia, it sounds like a little bit of it is trainable, and there might be points where it's you know interventions are needed, but so would you agree that it's trainable?
You hit the nail on the head. So much of it is trainable, and then sometimes we need to do a procedure. Sometimes we have to intervene with a teeny tiny little surgical procedure to give the tongue the freedom that it needs to be able to function. But
Mhm.
I actually, I do a lot of tongue tie procedures in the office. We numb it, use a laser, like we do it on infants, we do it on big kids, we do it on adults. Um, and it obviously not in our infants, but on our big kids and our adults, I require that they are working with a myofunctional therapist before I'll even agree to do the procedure, because they've got to get the tongue muscles and the whole muscles of the mouth complex. They've got to get those strengthened and trained, and then they need support to know how to then get those newly freed muscles to function correctly once the procedure is done.
Yeah.
Because usually in that case, we're doing sutures and we need to prevent scar tissue from forming.
Mhm.
So it's really important. It's very much like having a knee replacement and then doing physical therapy.
Right.
You have to do the physical therapy, or your surgery results will not be optimal.
Right. Well, it's interesting, that you're doing the laser procedure. I think even 10, 15 years ago, people would have to travel, outside their city, try to find a provider that does the laser technique versus other techniques. Is it
Mhm.
becoming more prevalent, or is it still seen as a very select specialty?
Thankfully, it's becoming much more prevalent. Um, it's still controversial, which is funny to me. Healthcare is so funny. Um, New in healthcare is like 30 years.
Hmm.
So,
Yeah.
so we're still in the new phase of this because laser frenectomies have been done for less than 30 years.
Okay.
So I hope that we can dispel some of the controversy soon. But yes, there are more and more dentists who are getting the training to do this. Um, there are some, pediatric, I think ENTs will do it. Most of them are not using a laser though. Most of them are using, scalpel or scissors or something like that.
Okay. Well, that was really helpful. And I think one of the threads to all this is, the changes that you spoke about related to mouth breathing and its impact on the oral microbiome. So, on this podcast, we've talked a lot about various microbiomes, you know, including the gut and the vaginal microbiome, and um, going into the skin microbiome. And the oral microbiome is often overlooked. And I'd love to hear how you define it and what all lives in the oral microbiome. Like, how expansive is it? Is it viruses? Is it fungi? Is it bacteria? What is it?
So, the oral microbiome is just the beautiful ecosystem of bacteria and other bugs that live in our mouth. And like you said, just like there's a unique skin microbiome and vaginal microbiome, eye microbiome, gut microbiome, and even in different parts of the gut, the microbiome is a little bit different. There will be overlaps. Some species are able to travel back and forth, but it has its own unique set. It really is an ecosystem in the mouth, and so far we've observed over 700 different species of bacteria, viruses, fungi. All kinds of really cool stuff in the mouth that can either help us stay well or promote illness and disease.
Yeah. And so it makes sense to me that the exposure to oxygen, and just where these bugs are living and their exposure to the environment makes them special and unique. Um, and one of the things I've heard, and I'd love to hear you talk about this, is the way they survive and how they're able to tolerate the environment. And plaque is something that we know of. I've heard that connected to biofilm. And can you talk about the strategies these bugs, good and bad microbes, use to survive this environment that's seemingly like has a lot going on, a lot of activity?
Right? Yeah, it's not like other parts of the body. It's not like your intestinal microbiome
Right.
where it kind of has a pretty steady um, environment. Like
Right.
things are relatively the same throughout the day. In your mouth, who knows what's going on in there? The temperatures vary widely, the pH varies
Yeah.
widely.
Yeah.
So yeah, it's really fascinating. And dental plaque that is on your teeth actually is a biofilm. And it sounds like you've talked about it a lot. So I'm sure your audience knows a biofilm is really just this beautiful super city of bacterial colonies. It's like the bacteria universe. Here's the best example. Do you remember the movie Men in Black?
Oh yeah.
And in one of them, I'm not sure if it was the first one or if it was one of the sequels, but there was a cat called Orion. And Orion had, this little collar and this little medallion
Hmm.
on its collar. And inside the little medallion was an entire galaxy that with planets and living beings and all these things. That is similar to the microbiome in your mouth. It is like this entire galaxy. And what we know is that when the bacteria get together to form this biofilm, then they have modes of communication. They have ways to transport to different areas. They have like highways and roads and super highways. They can talk to each other. They've got like their own police force. And so it's really fascinating. And when it's healthy, when it's in balance, so you can have some dental plaque with a healthy microbiome. And what's amazing is that when your microbiome is healthy, then your dental plaque will actually be self limiting.
Mm.
It will be self limiting. It doesn't want to get big and bulky and out of control. It wants to stay nice and thin. It exists peacefully with its host. So it's not going to bug you.
Hmm.
Bug. See what I did
I
there?
guess.
Dad joke. Um, so it all just kind of is this kumbaya kind of situation. Most of them are aerobes, so they like oxygen, or they're facultative anaerobes. Like they can kind of go either way. They can survive with a little bit of oxygen, but they don't necessarily have to have it.
Hmm.
And so that's when things are in balance. The pH is fairly neutral most of the time. Now, when things get out of balance, and there are 5,700 different ways that it can get out of balance, we'll talk about some of them here in a minute. But when things are out of balance, then it can shift the entire pH of the mouth. So the saliva can shift to be very acidic. It no longer cares if it's thin or not. It would rather make the city a whole lot bigger.
Hmm.
And so the thickness of the plaque and the tartar buildup will increase. So when plaque has time to just sit on the teeth when it's not disrupted by brushing and flossing, it sits on the teeth for a long time, then the minerals in your saliva will adhere to it. And when the plaque becomes mineralized, it becomes hard tartar buildup that you can't get off with toothbrush or floss. Then you have to come in to the dental office and have the hygienist take it off for you with all of her fun tools and gadgets.
Yeah.
So that imbalanced microbiome is really really inflammatory. So some of those bacteria they'll ingest the carbohydrates that you eat, and they will poop out acid. And so that acid is what causes cavities. And some of them will feed on dead and dying blood cells
Mm.
in your own inflamed gums.
Mm.
So they crave more inflammation, and then it becomes like this icky cycle where the more that bacteria is, the more it's eating on your inflamed gum tissue, and the more that happens, the more inflamed your gum tissue becomes.
These are like sinister strategies that they have.
It's like a sci-fi movie,
Yeah,
right?
it is
Yeah.
really fascinating. And with the mic the biofilm, it's always been such a difficult concept to test. Meaning, if you're walled off from in your own galaxy, like you say, nobody knows what's going on in that galaxy. Really,
Yeah.
you can't get into the galaxy. So how do we even know with clinically what to do about the biofilm and like what's actually in it? Is it healthy biofilm? Is it not? I mean, is there a way through your testing that you found that you can interpret that?
Yeah, so in the old days, we would just have to go off of clinical signs and symptoms. So we would have to look and see, is the plaque thin and easy to remove, or is it sticky and tacky and not healthy feeling, or is there a ton of buildup of tartar that has to be removed, with our bigger tools. Um, are the gums bleeding? Are we seeing signs of gum disease, like when the hygienist takes the little pokey thing and measures around the gums and calls out all those numbers? Do you have small numbers like ones and twos and threes, or do you have bigger numbers like fours and fives, and the hygienist says, oh, those are bleeding pockets? So used to, we could only just look at those clinical signs, but now we can, and especially if we're seeing some of those clinical signs already, then all we have to do is have our patients spit in a tube. That's it. Because there are good labs, and I've got a couple of favorites. But there is some good lab testing where they can analyze that, and within a couple of weeks, then we know exactly which bacteria they're seeing, or if there's an overgrowth of candida, um, or anything like that, so that we'll know, like, okay, here's what we're dealing with. Here are the bad actors in the microbiome city in the mouth. So what do we specifically need to do to tweak these strains of bacteria? Because some of them respond better to oxygen, so then we're using ozone and peroxide
Mm,
treatments. Some of them respond better to very specific probiotics, because
mhm,
the probiotic species will create their own bacteriocins, and that can kill some of the bad gut bugs.
mhm,
Um, and then sometimes if things are scary and we're worried about where the microbiome is and we're seeing clinical signs, then we take more of a blowtorch approach. Like, we may have them do an antimicrobial rinse,
mhm,
no, for a couple of weeks. We're not doing it for a long period of time, but doing it for a couple of weeks so that we can knock down all of the bacteria, knowing that we're going to kill some of the good with the bad.
mhm.
And then we're reseeding after that with the probiotics that we want to be in there.
Gotcha. Wow, that is really fascinating. And I think one of the articles or posts that you wrote was referring a little bit to the impact of this scenario and you said it was like the paper that changed your career. I think was the name of your post, and not to
Mhm.
scare people, but I don't think people realize the research and what's out there as far as what this scenario means systemically. And it's something that I think about a lot. Um, and can you share a bit about the paper? I think it was a paper related to stroke or cardiovascular disease. Yeah, and I'd love to hear your thoughts about like why this is so important, not just in our mouth but elsewhere.
Yeah, absolutely. Well, and what's sad is that that's what it took
Mhm,
for the light bulb to go off in my own head. Um, because we were trained in dental school to know that the health of the mouth is really important. Um, but I don't think I understood or I really grasped the just the proof that was undeniable proof that there is a direct connection to the health of the mouth and the health of everything else. So in this particular study that you're talking about, I believe the main author was a last name was Pessy, and so the Pessy study. It was published in the Journal of the American Heart Association. Circulation is the name of the journal, and this was a study in, I want to say, maybe 2015 ish. Maybe it was a little earlier than that. But in this study, they took 100 patients that were having a heart attack. Um, they were in the middle of a cardiac event. And the solution was a procedure. And so as part of, how they were helping these patients get through their heart attack, they were obviously removing the clots in the coronary arteries that were causing the heart attack. Well, then they took those clots and they looked at them under a microscope. And what they found is that under the microscope, these clots that were causing heart attacks in these patients, that I think it was like 40% of the clots had bacteria that were directly implicated in gum disease.
Hmm.
It's huge, huge percentage of these clots had gum disease causing bacteria. And then the real kicker was that then over 70% of those clots had endodontic specific bacteria. That means bacteria that are around tooth infections. So root canal type of bacteria
Mhm.
in over 70% of those clots.
Wow.
So it was just in your face, undeniable proof that, man, what's going on in your mouth actually is going on in the rest of your body
Yeah.
too. And it makes just so much sense when you think about it. I was just too busy thinking about, tooth carpentry to pay attention.
Yeah.
Is that, when you take medication, so much of the medication that sometimes we take is they'll tell you to put it under your tongue because that tissue is so absorbent and gets into your bloodstream
Mhm.
faster.
Mhm.
When you've got all of this really highly circulated tissue that's in your oral mucosa, all the pink stuff is just highly, highly absorbent. And so not only will you absorb the medications that you put in your mouth, you'll absorb the weird chemicals you put in your mouth, the dumb, weird, gross crap that you brush your teeth or rinse your mouth
Yeah.
with, you're going to absorb. And the bacteria that's out of balance, you're going to absorb that too into your circulatory system.
Mm.
And that has just a profound impact on the rest of your health.
Amazing. It's, um, you know, I think the scary part is when people learn that when they've already are kind of far down the road. So it'd be interesting, at some point maybe to circle back with you, even if we have time today, just to hear people who are like really bad off and they were able to improve their oral health and maybe reduce some of those risks.
Yeah.
But um, it's I think at this point, like I think people sitting there listening to this and they're like, "Wow, I better get on top of this oral microbiome uh, issue." Especially if they're in the prevention mode or if they've already started to see some issues. What's like a 3-step checklist to start supporting our oral microbiome at home? What would be a good way to start?
Mm, I think some great, easy ways. I mean, the basics. When you brush, I do think we want to keep the biofilm thin. So I really like a Sonicare as a toothbrush. I think the electric toothbrushes do work better. You do get your money's worth.
Mm-hmm.
I really like tongue scraping. So if you've never been a tongue scraper, I promise, guys, it will change your life. It will end your breath. 'Cause there's a ton of bacteria that likes to live in all the little nooks and crannies of your
Mhm.
tongue, and you just can't get them out. You can't get them
Yeah.
off nearly as well with just a toothbrush.
Yeah.
So the tongue scrapers do an amazing job. So that, just basic, like normal oral hygiene stuff. Some other really easy, simple things that you can do is just getting xylitol products that you like.
Mhm.
So gums or mints or candies or sprays, anything with xylitol, and xylitol starts with an X. So xylitol, it's a plant-based sweetener. It is a sugar alcohol that's similar enough in structure to sugar that the bad bacteria will ingest it. They'll take it in, but they can't metabolize it.
Mm.
So they wind up kind of dying off over time. So over time, it's just a great shift in the microbiome that selects for more of those helpful bacteria.
Mhm.
And in the short term, it also raises the pH of your saliva. So, anytime you have something acidic or if you have a treat or something like that, then xylitol can help reverse those negative effects too. Um, and then a third, so oral hygiene, xylitol, and then there's some good oral probiotics out there
Mhm.
now, and that's just so easy. They're usually in tablet form. It's not the same. When I say probiotic, I don't mean a capsule like you take for your gut health. The capsule is designed to absorb the acidity of your stomach and make it down into your intestines.
Mhm.
An oral probiotic is going to be in tablet form and it's meant to dissolve in your saliva. So they're usually in mint form. It's going to be a tablet. They're, mint flavored, fruit flavored for kids and stuff like that. But those are just really easy ways to make these positive shifts over time.
That's great. I really like that, those practices. It's great to hear about that tongue scraping actually, it's actually does something therapeutic. I mean, obviously I've heard about it for improving breath, but it's great to hear that it's actually restorative, for the microbiome. The I have to the skeptic in me always gets a little bit puzzled about oral probiotics because I take them and I'm always just so confused as to how this probiotic is actually sticking around where I want it to stick around. Like,
Yeah.
do I take it at bedtime? Do I take it, you know, after I brush my teeth? Do I is the last thing I do? Is there a sequence for it?
I think it's, you're right. You don't want to kill just like any probiotic, you don't want to kill it off as soon as you take it. So I think right before bed, after you've done all your other oral hygiene stuff, I think that's a good time to take
Hmm.
it. Or, in the morning on your way to work, after you've already done all your morning routine stuff,
Hmm.
I think that's a good time too.
Excellent. Well, great. So we've talked a lot today about the different aspects and alluded to the major aspect of having uh, sort of oral microbiome imbalances and chronic disease, and you have a special interest in autoimmunity. Before we leave today, I'd like to hear a little bit about where you're at with working with autoimmune patients and sort of how that fits into your practice.
Well, you're right. That's personal to me because that's how I got started in biological dentistry was after I had my own autoimmune illness and man, just Western medicine didn't give me the answers that I needed. Um, and so what shifted for me is when I realized how similar, because I did, by the way, I did find ways. I had to go down all the rabbit holes myself. I didn't know about functional medicine. I didn't
Mhm.
have a naturopath that I knew I could go to. I
Mhm.
was just new to the whole holistic world, didn't even know what it was. But I did find ways that nutrition and lifestyle and managing my own stress, I did actually heal and get better and weaned myself off of all of my medications over a decade ago. So grateful for that because I know that's not everybody's story. Um, and what really made the shift in my career was when I started just making these correlations and seeing how similar it was Um, the yeah, Crohn's disease is what I was diagnosed with. It's an autoimmune condition, but it's an inflammation in the gut caused in part by the dysbiosis
Hmm.
in the gut. When I finally got bad enough that I had terrible symptoms and got my diagnosis, it was after I had taken some antibiotics for a sinus infection because
Hmm.
I thought, oh, no big deal. Let me just take some antibiotics and knock this out because I'm tired of my sinus infection.
Yeah.
Not knowing that that could potentially have negative consequences on the back end.
Hmm.
Um, so, man, if you think about inflammation and dysbiosis, and I just kept seeing it over and over again, it's like, well, good grief. What I treat every day in my office is tooth decay and gum disease. It's all about inflammation and dysbiosis in the very first part of your gut, which is your mouth.
Hmm.
And so I knew I was like, okay, if I can figure out how to make myself well when I know nothing, I don't know anything about what I'm doing here, then I have to be able to figure this out for my patients too. And so again, not knowing where to go, not knowing if there are any dentists who believe this stuff too, I started getting into oral systemic health. And then, my patients really started nudging me the rest of the way. We started talking about nutrition in the office and preventive strategies. And my patients would say things like, "That's great, Dr. Toni, but what are you still doing with fluoride?
Yeah.
Like, why are you still using this stuff?" I'm like, "Oh, well, the ADA says blah, blah,
Right.
blah, 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 blah." Um, and the more they would challenge me, the more I would have to look stuff up and dang it, learn new things.
Yeah.
And
Yeah.
so that's what shifted the practice, really.
Amazing. Yeah. So it reminds me, that everybody always talks about, well, all disease begins in the gut, right? And that's like a common saying, but I think, just connecting like this concept that, you know, and the mouth, we
Which
can't.
is the mouth. Yeah,
Right.
the gut, which is the mouth. Yeah.
Exactly. It's the first, and it's the first part of the digestive process, the
Yep.
cephalic phase. And so we have to, it's one of the beautiful things about the work that you do and integrative providers do is it's like not these separate parts of the body that have their own domain. It's like the connections, the holistic approach. So this has been wonderful. I could talk to you about so many things related to this topic, and I know we only have so much time. So before we wrap up, I want to hear a little bit about Flourish Dental and your work and some of the things that you want our listeners to know about. That would be great. And then if you could leave us with just revisit a couple two small daily practices that can improve oral health or overall health.
Um, so Flourish Dental Boutique is the name of my practice. Right now, we have one location in Richardson, Texas, which is just outside of Dallas, and we're opening a second location hopefully early next year. Trying to get that open and going quickly. So maybe in the next few years there will be a Flourish Dental Boutique near you, but
Right.
happy in the meantime for any of you to come visit us in Dallas. We do have patients who travel in all the time. So we would love to see you once we get everybody healthy. It doesn't take just a ton of time in the dental office. You come see us a couple of times a year, and we're happy to help you get well and then send you back to your regular dentist if you're super far away.
Hmm.
Um, so happy to see anybody. Our website's www.flourish.dental. And I spend a good bit of time on YouTube and Instagram. Instagram's probably our most active platform right now. And that's just my name. It's at Dr. Toni Ingram. So happy to see you there as well. We have an online course if anybody wants to go through like a DIY, do it yourself, reverse that cavity process, or if you've got kiddos that are struggling with cavities, we've got an online course called The Cavity Cure. And you can find links to that on our website and on our Instagram as well. Um, Really, if I could just leave your audience with the most important takeaways. So, yes, I love nasal sprays. I love mouth taping. I love brushing and flossing, even though that's not sexy anymore. I get it.
Yeah.
I love tongue scraping. I love all things xylitol. Xylitol is my friend. Um, we didn't even talk about toothpaste ingredients. So fun fact, and maybe controversial with your audience, maybe not. But you don't need fluoride to prevent or treat cavities. Believe it or not, it is not an essential nutrient. And
Mm.
so I try to get all of my patients on a good remineralizing toothpaste. My favorite ones, the most effective ones, have calcium hydroxyapatite in them. So look for those ingredients, and if not, then just look for good, clean ingredients that you can pronounce. Nothing crazy. You don't need a bunch of weird chemicals in your toothpaste.
Mm.
Um, but most importantly, I want everybody to know that your teeth, your mouth, the rest of your body, you were designed to heal.
Mm.
So if you take nothing else away, just know that you're designed to heal. You can get well from cavities. You can get well from gum disease. You can heal from so many things. If you just give the body what it needs, give it the support it needs. You don't need to knock out symptoms with a bunch of chemicals and pharmaceuticals and surgeries. So that would be my lasting takeaway.
Amazing. That was such a great way to conclude for today. I thank you for being here.
You bet. Thank you. I'm so glad to be here.
Thank you so much for listening to the episode with Dr. Toni Ingram, where we went into all aspects of the oral microbiome, saliva, breathing, and talking about the connection of oral health with systemic disease. I think one of the takeaways for this is just how important it is to have these practices in place as our daily routine, and all the different concepts of how to nourish the oral microbiome and nourish our gum health, and practice breathing in a way that supports our oral microbiome and supports our overall oral health. And these are really useful tips. And what I'd like to do is see if the audience can apply some of these techniques or strategies that we talked about today, and put together, say, a routine, and in order of how you do the routine. And if you could place that routine, say, on the counter of your bathroom sink, and take a picture of the oral products that you do, and describe your dental hygiene routine. Take a picture and tag the One Thing Podcast Instagram account. And if you could do that, and what I'll do is I'll select one winner from those pictures, and I will send out one free testing kit for testing your oral microbiome. So please do that. This contest will last for 2 weeks after the launch date of this episode. And so just listen for this. And if you've heard this, where you want to tag is One Thing Podcast on Instagram, at One Thing Podcast. So looking forward to that, and looking forward to sharing future episodes with you. Thank you for listening to the One Thing Podcast.